is Q13 News at 5.
That's a fantastic one. Coming up next, a new study shows vitamin D levels are tied to breast cancer survival.
Next, Dr. Ari Gilmore joins us here in studio, and I'll ask him how much vitamin D we all need a day, why it's so good for us, and can you get too much of it? All that's next. We know vitamin D is so important for healthy bones. Now a new study finds higher vitamin D levels may be linked to longer breast cancer survival rates. And the research was published in the Journal of the American Medical Association. And Dr. Ari Gilmore with Pacific Medical Center is here to talk to us more about this and what this study found, which is very exciting news for women. So what did it exactly show?
Well, it was a pretty good study that looked at women who had already been diagnosed with cancer, breast cancer, looked at their vitamin D levels shortly after their diagnosis, and then followed them out to see how people fared. What it found was that women who had higher vitamin D levels had better success rates long-term and with survival, which is obviously a pretty big endpoint.
Certainly. Do we know why that's the case?
It's not absolutely clear. The authors were cautious about how to interpret it. A couple of things that really stood out and were interesting for women who are premenopausal, they had a much better survival rate. So it was impacting them almost with 50% better survival rates versus women who are older, postmenopausal, where it was a more modest effect, about 25%. They did try and control for a lot of other variables, and it really looks like vitamin D was an important factor.
Okay, so let's take that information a step further. How much should women be getting, particularly those who have breast cancer now?
Right. So in the study, the people who had the higher vitamin D did much better, and there's good reason to think it is due to the vitamin D itself and that it affects the immune system. Numerous other studies have pointed that out. So if someone wanted to make sure they're getting enough, especially in the winter time from Halloween to spring break, they should be taking 800 units daily if they're an adult. Here in Seattle, it's so dark and rainy. Maybe taking 2,000 a day to make up for the days you forget would be reasonable.
Yeah, and that's not just for breast cancer patients, but for all of us?
That's for everybody. And in our clinic, we're really recommending people with skin darker than me, people who work night jobs and aren't out in the day that much during the summer, kind of building up those stores, go ahead and supplement at that 2,000 units per day.
Can you get too much vitamin D? Can you overload and have it have an opposite effect?
That's good news. There's no way to overdo it.
Okay.
I don't think there's a benefit of going above the 2,000 or 4,000 a day. If people are extremely low, down in the symptomatic, where they have muscle aches and pains, they're below 5 nanograms on their blood tests, we'll actually do 50,000 units once a week for 8 weeks to build their stores up.
Oh, great information. While we've got you here, I want to talk about stress and anxiety. We've got some people who are dealing with post-election stress. We've got others who have pre-stress when we go into the holidays and a lot of anxiety. At what point, when you're with your family and friends, do you need to start noticing red flags and what to do about it?
Right. Anxiety affects us all, and stress is a good thing. Without a little stress, we don't get things done. But when it gets to the point where people are irritable, things that wouldn't bother you you're yelling at other people when you're driving, and insomnia is a big factor. If people are lying in bed for long periods of time, trying to let go of their day and just not finding that they're falling asleep within 20 minutes or so. If your friends are telling you, hey, you're very stressed out, you don't seem like yourself, it's time to start thinking about doing something about it.
Yeah, seek some medical help. I want to let you guys know at home, Dr. Gilmore is going to stick around after the news, and we're going to have a chat with him on Facebook Live about this. So if you have questions, join us for that. But great information about vitamin D, certainly since we don't get a lot of it here in the Pacific Northwest, to make sure that we add that to our daily routine. I've got to do it as well. Dr. Gilmore, always good to see you.
All right, thanks for having me.
Matt and Walter, back to you.
We will take part in that Facebook Live conversation. We will also start taking our vitamin D as well. We were just talking about it. Often forget to do so.
It's so dark. And like you said, it's so dark. So let's get out there and get a little something. And I do have some vitamin D sunshine tomorrow.